talk about the Medicaid plans that were available. There's more than just low-income Medicaid. At Children's, we have what's called a Right from the Start Medicaid project worker located at each one of our facilities. And we partner with the state so that when our families come in, and our financial counselors, this is basically when they come in as uninsured, so we can actually screen anyone. When you come in as uninsured, our counselors will give you a call, or if you're admitted to the hospital, we'll come up to the bedside and do what we call a screening. We're doing that financial screening. We're finding out your family size and your income. That's going to tell us where you will fall in this category and what resources are out there and available to you. And what I'm going to do today is just kind of give you guys an overview of what these Medicaid programs are, and to let you know that don't just close the door thinking, well, maybe I have health insurance, but there's nothing else that, maybe my out-of-pocket is just overwhelming, and I'm not eligible for Medicaid because I make X, Y, and Z. Well, there's the medically needy program that is based on your income and resources. So if you have a catastrophic event, there's a probability that April or John or myself can get with you and look at the total charges of the hospital bill, review your income and resources, and there's a probability that medically needy can help with that one event. Okay, so what I'll do is give you an overview, and please feel free to engage and ask questions. And I know that everything won't be answered here today, but what we want you to do is take the slides. We have some business cards. Any questions that you might have, just give us a call. We'll be more than happy to sit down and talk to you, go over details with you in your particular case. If you have questions about your current insurance, we do not verify insurance. We have an insurance verification team, but we can get you to that right address. The importance of returning all required documentation in a timely manner. If you're seeking assistance from the state of Georgia, everything's time sensitive. So if a financial counselor is calling you and it seems that we're getting a little aggressive with, please, we need to get your documents, or we need your income, or we need this, it's because we have 90 days from the date that you're in our facility. Your discharge date, the date that you leave our facility, the clock starts to tick. So in order for us to be able to help you, we've got 90 days from that date of discharge. So it's very time sensitive. So we're gonna call you and it's like, Ms. Jones, please, we need to get your income. We need to get your, if you're applying for medically needy, we need to get your bank statements. Right, exactly. So it's important. If you hear a counselor telling you, ma'am, I have to have it, or sir, I really need that before such and such date, if we lose that date, our goal is to secure the date so that we can get that coverage for you and your family. If we lose the date, then they won't go back and cover that. We can, if you're applying for regular Medicaid, Medicaid will go back 3 months if you're applying for regular Medicaid. So if your visit's today, if a child comes into our emergency room today is April 30th, we have until May, June, July to secure a Medicaid application. So that's a pretty big window. But when you're trying to get resources and work with a family that you have other things going on because there's life, it's kind of hard. That window starts to close up. The benefits of applying for CHOA at a CHOA facility as opposed to a local DFACS office is the fact that you have the personal attention of our counselors. You don't have that 2, 3, 4 hour wait. I've had some parents to tell me that they waited a full day, and then they had to go back the next day, and then they were bumped to the back of the line. So we're here. We're that resource. Please, we're available to you. We can help you with the Medicaid application, and we want to do that. It's our pleasure.
Yeah, you get the CHOA experience.
Yeah, exactly. An applicant can take any mail. If you have any mail that you've received from the state regarding bills, Medicaid that you applied for, and it just doesn't make sense, guess what? We're here. We'll help you make sense of it. We have counselors located at Scottish Rite, Eggleston, Hughes Spalding, and here at Tully Circle. So we're all over the place, and our goal is to meet you where you are. So say, for instance, you were admitted at Eggleston, but you live close to Scottish Rite, you don't have to go back to Eggleston to complete that Medicaid application or to see a counselor to get some help with figuring out what's what. Go to Scottish Rite. If you live downtown in the metro area, go to Goose Holding. We're there. Our face is all over the place, and we're there for you. Recertification is the most important thing. Here in the state of Georgia, if you're covered on regular Medicaid, that Medicaid is only good. The eligibility span is 6 months. If you don't recertify, it drops. And the thing about the Medicaid dropping is that you have to start the process all over again. If you stay on top of things, and if you recert, they'll send you a letter saying, what they basically want to know is everything still the same. If you say yes, they're okay with it. They'll say, good, your coverage will continue. But if you do not respond, if a parent doesn't respond to them, then the case is dropped. And guess what? When the coverage drops, that's when that emergency happens. And you come into our ER, and we have, in our registration pathway, we verify eligibility at the time that you're registered. So that's why a registrar can come back and tell you, oh, your coverage is not, your Medicaid is not valid, or your Cigna is not active, or this is not active, or you have a $100 copay. That's because we verify coverage. It's a seamless process. It just happens magically. Any questions? Whenever you're dealing with a caseworker, whether it's an old case, you have Medicaid, whenever, always get that caseload, know the county that you were in, and get a contact phone number. If you give us those 3 things, then we can kind of make some things happen. Low-income Medicaid. This is the Medicaid that's probably the most popular. It applies to families whose total household income is below the 100% poverty level. And that's usually, if you're eligible for low-income Medicaid, you're eligible for food stamps as well. Right from the Start Medicaid. This is what we do. We partner with them. We work with the Right from the Start Medicaid program project. We have workers at each one of our facilities. So if you do a Medicaid application and get that SHOA experience, get all the information that we have to offer you, then we're gonna, once your application is done, and we're like a prerequisite for the Medicaid office. So what we're gonna do all the groundwork. When we give that application to that RSM worker, we're telling her that we're 99.9% sure that they're eligible. And the reason I said 99.9% is because if the state has the ability to check SSI, child support, and unemployment. So when you're being screened, even in your local DFACS office, if they're asking you for all of your income, you really have to disclose all of your income, because once the Social Security number is put into that database, if you're receiving child support, I don't care if it's $25, and we know that sucks, but it's still your income. So you have to disclose that, and if you don't, then that application can be denied. So it's really important that when we talk to you and we're asking you for income and we're asking for proof of income, that you disclose everything. And maybe you're over income for this particular program, but like I said, there are others. So we can go through the process and see what you're eligible for. Medically needy. This is pretty popular. And this is kind of a secret the state has. But the medically needy is your household income must exceed standard income limit. Unpaid medical bills exceed monthly income. It's like they have this formula where they do a deductible. The resource level, the charge level is $4,000. So we can start considering, you come in, maybe you have your over income for right from the start for regular Medicaid. Your charges are $5,000. We're going to call you up and say, okay, we'll screen to get your family size and income. You give us that information. Then we're going to tell you that, well, there's your medically needy. Your charges are at $4,000 or $5,000. So there's potentially a probability that you could be eligible for this. Now, what we're going to need is your resources. So if you have an automobile, home, things like that, they take that into consideration, and then they use that like a deductible. to get to the point to see where. Now, with the medically needy program, there's a possibility, if you're approved, that you can have what they call a spin down. We would call it a deductible. You have a $12,000 bill, they're taking your income and resources based on what you've provided. They can pay the bill, all of it except $500. So we would tell you, you were approved for Medicaid for this situation, for this event. They're going to pay the bill, but you have to pay the first $500, as opposed to paying a $12,000 bill. That's not bad. KD Beckett waiver. I'm sure some of you are familiar with this. My team does not do these applications, but we partner with our social work department. This is really clinically based. It's a disabling condition. Parents are over income for SSI benefits, and it's a very long process. But we have social workers here that will help you through that. Again, if it's something if that referral is needed, when we screen, we'll know that, and we'll let you know. We'll partner with you and get you to the right resource. The social worker will probably have already identified that.
And then another thing with the KBAC is sometimes you may be eligible for medically needy for this particular visit, and the financial counselor may suggest that for future plans that you apply for KBAC or SSI.
Exactly. See, we're pretty savvy. You give us the opportunity, and we're going to look at all your we're going to look at everything. We're going to make sure that we can find, if it's out there, we're going to find it. Any questions? Emergency medical assistance. This is for non-U.S. citizens. This is a one-time event. It's based on the severity of the situation. It has to be, it's not considered emergency Medicaid. It's an emergency event, meaning something's life-threatening. And we use this quite a bit. There's a form that has to be signed by the physician saying, yes, I agree that this event was life-threatening. Then we do the same thing. We screen, get the family signs and income, get all the documents, forward them over to the RSN worker, and that's a one-time coverage for that.
So if you're a U.S. citizen, you're not eligible for that?
Exactly. Right. You're not eligible for that, but you're eligible for right from the start Medicaid or medically needy. Right. This is not the EMA is not ongoing coverage. If you get right from the start Medicaid, that's ongoing for 6 months. Medically needy is what time?
Medically needy,
It could.
it depends on, like, say,
Care if you're in-house.
your child was in the hospital for 10 days, it'll cover that whole 10 days.
Right. But each month that you're in, the state's pretty smart too. Each month that you're in the hospital, you have to re-verify your income and resources every month, because the ideal is that everything has stayed the same or maybe dropped. Dropped is better, because then we can move you into another program. Teach Care for Kids. Parents' income exceeds standard limits for right from the start. And this is a very popular program. This ensures that basically every child in Georgia can have health care coverage. And it pays just like Medicaid, no co-pays, no deductible, but the parent will have a slight premium. And with this coverage, if the premium is not paid, the coverage drops immediately. And you have to pay the premium to be reinstated. So if the parents are not real savvy with keeping those premiums paid and paid for, you could be up, down, up, down, up, down, and they do not reinstate. If you don't pay the coverage, if you don't pay the premium, there is no coverage. And it's just that kind of thing. And that's the information for Teach Care for Kids. SSI benefits, that's automatically enrolled. SSI recipients are automatically enrolled in the Medicaid program. SSI would be the federal Medicaid. Federal Medicaid. Federally funded Medicaid, as opposed to the state. And we do not do SSI applications, but we can help facilitate that. We can get you to the right office, see where you live, what you need to do, all the documents, whatever. This is really, I love this program. This is probably the state of Georgia's, I think this is their best kept secret. This is the health insurance premium payment program. And what Medicaid is saying that if you have health insurance. You have actual health, you have Blue Cross, but your Blue Cross premiums are a bit much right now. You qualify for Medicaid, you got that Medicaid secondary. They said, okay, I'll pay your Blue Cross premium for you as long as you're covered, as long as you're active for Medicaid. So you got to keep that Medicaid active, follow the rules with them, make sure you do the research and everything. They'll pay that premium. What you have to do is pay it first, and then you send the statement. They have some paperwork, and then they'll reimburse you. And we, questions?
I just had a question on the Georgia Peach Care. So you can't have private insurance to get that. Is that, do they work together with your private insurance?
No, use Peach Care as a secondary. No, you cannot. Any other questions? Yes.
If we lost if we lost our insurance through an employer, could you then go to Peach Care? Would it be pre-existing, or they'll still cover?
Oh, they'll cover, yes. As long as you meet the qualifications, they will cover.
Is there a fee period?
For Peach Care, you have to apply by the 15th, by the first of the, they do have like a waiting period. There's a cutoff, and I don't know that exactly, but we can find out. Your premiums have to be paid before the 15th of the month to be covered for that month. That's how it works. But no, there's no waiting period. You do the documentation. It depends on when you do it. You send everything in that they need, and they'll approve you right away as long as you're eligible. Yes. Peach Care does not retro coverage, though. So, meaning if you drop it or you apply after the 15th, you're not going to have it for that particular month, but moving forward, you'll have it. So if you're scheduling, you need to schedule a surgery at Children's, and you do know that you're eligible for Peach Care, go ahead and get all that. Talk to the financial counselor so we can help you do the application online, help facilitate that with you, get the payment if the payment is required, and then you can let your physician know that I'm applying for Peach Care. I should have an answer within the next couple of weeks. It takes like 2 to 3 weeks for them to, yeah. Yes.
We have an adopted child that's covered under the Katie Beckett.
Okay.
And we were told years ago when we first adopted him that if we put him on our insurance that he would lose the Medicaid. So is that not the case? Because he's getting to that transition time.
Oh, that I'm not sure. I would have to, you can email me. We have my business card. If you email me that question, then I can pose it to the appropriate person.
Okay.
And get an answer for you. Yes. Oh, yes. I'm sorry.
Yes, does that HIP program kick in if you have lost coverage through your employer for layoff and you are COBRA?
They will not. That's really ironic. Oops, that you said that. We're working with the COBRA situation right now, and HIP will not. I'm sorry. HIP will not activate your COBRA, but they will pay if you're already, like if you're in the middle, if you've already started the COBRA payment, you've done the you've initiated COBRA, you've been on COBRA, and now you realize that it's too much. Then you can submit an application before it lapses, and they'll take it into
And
consideration.
will you guys help us?
Sure.
Even when we're not in a pending surgery situation?
Oh, absolutely. Yes. You're ours.
I had a similar question.
Okay.
You mentioned at the beginning that if you have a hospitalization, that you have 90 days from that point. Does my child have to have hospitalization?
No.
In order for you to?
Absolutely not. Absolutely not. We're here as a service to our families, regardless. Any other? Yes, sir. I'm sorry.
Do you provide service to find out if you are eligible for Katie Beckett and that kind of thing? Can you walk us through your application process?
Yes, that would be our social work department. We would partner with them to get you to the correct person because it's clinically based and they know from the diagnoses and what's going on. So yes, I could get someone that can help with that, yes. Absolutely. And we'll get business cards.
Documentation from your physician as well.
I'm sorry, I didn't hear that last part.
I said, for the Katie Beckett and also SSI, they would need the documentation from your physician as well, because you have to document what the actual condition is.
Good questions. Yes.
Will this program also help with the Peach Care premiums, or is it just for the?
No, because it's coming out of the same bucket. Yeah, it's from the state of Georgia now. And we can give you a business card Because if there's some issues with Peach Care, yeah, we can talk about that. Any other questions? Good question. Helpful information. This is a website for you guys, parent to parent. Georgia website provides support and other information for parents of children with disabilities. But what we want you guys to take away from here is that we have financial counselors. We're your financial advocate. It's our job. It's our pleasure to help facilitate and guide you through to know your options. And let's decide, is this what I need to do or this? Or maybe none of this works. Because we know that you got this clinical stuff going on, so let us help with the financial piece. And we have 3 counselors at the Scottish Rite, one in the emergency room, one inpatient, and one outpatient counselor. At Eggleston, we have 2. We have April and John. At Hughes Quality, we have 4. We have one inpatient, one ER counselor, one outpatient counselor, and one urgent care. And here at the call center at Tully Circle, and at any of those locations, we can screen, do Medicaid applications, and we have an RSM worker to forward that information to. So please, we're at your service. We're like a concierge. Forever. Yes. Yes, we have.
You just hearing about this for the first time?
Wow.
2004.
Really?
No, nothing.
Oh.
Katie Beckett and all that, we were completely on our own.
Oh, I'm sorry.
Nobody.
We've evolved. We've grown. We've really grown. We established our call center in 2008. We just moved over to Hughes Quality in 2006. We've always had an inpatient counselor at Scottish Rite and Eggleston. And we do bedside counseling. So when a family is uninsured and admitted to the hospital, we go to the bedside. Yeah, right.
Have insurance.
Exactly. That's been our focus, but now, yes, exactly.
We needed help, and there was.
And we realized that. So that's why we've expanded our services. We have a financial counseling call center here at Tully, and that number is 785-5060. We have I'm sorry, yeah, 404-785-5060. That's a resource center. Any questions? We have a charity coordinator on our team. If you have charity questions, we're here. And I thank to Allison for giving us the opportunity to become visible. Because we want to do this and let the parents know that we are here. Ask us. Dump on us. Say, look, I can't deal with this right now. Will you, this, and this. There's some things we will need from you in order to make things happen. And, and we might, sometimes it can be challenging because we'll ask and things are time sensitive. Like today is the last day of the month. And if we need to get your application secured, then we might push a little. Well, I'm sorry, we need it. Can I meet you halfway? You want to meet me at the expressway? Meet me at McDonald's at Tully. We'll do those type of things, but we're here.
I'm sure you guys do a great job at the hospital helping families. But I think a big issue is the doctors. Because I was at, a year ago, we had no insurance, and it was time for my son's yearly checkup, and I had to call the doctor's office and say, I can't bring him in because I can't pay for it, and we have no insurance. And you would have thought that they would have said, there's a program.
Right. Well, we are working with our physicians to let them know that we exist, and we do, there are certain groups that we're partnering with, and we're just getting the visibility. So, you guys can share in the community. Other families, other parents that you meet on the floors, if they're saying, I have some financial issues and I really just don't know what to do, there's a financial counseling call center here at Showa.
And the social workers are
a resource.
Inpatient,
That's true.
The social workers are a big resource because they can, maybe you have these products, but you still have a huge out-of-pocket or deductible.
That's very common.
You need a secondary to go along with your Blue Cross.
Yeah.
The social worker can give us a call and say, hey, I have a family here and they need to talk to a counselor.
Yeah.
So that way we'll know you're there and hand some paperwork.
Right. Wow.
Do you have to have,
I'm sorry. I'll get 1 second, sir. I'm sorry.
do you have to have an event here at Showa? Because like my son was hospitalized a couple years ago with pneumonia, and he didn't have to come here, but he was a week in Athens.
No, for us to no, absolutely not. We're available. We're a resource. Now, maybe we can't get into Athens and tell them how to run their program, but we can definitely tell you, we can help facilitate you through that process with them. Well, you need to ask them about X, Y, and Z. Sure. Sir.
Our child is currently on our insurance, but as she progressively gets older, she'll not be eligible for our insurance anymore. So what do you do in that situation?
That's a black hole in Georgia right now, and I don't have an answer for that. That is something that that's being addressed by the state, because once Medicaid covers up to the age 19, I'm sorry, up to age 19, and after 19, and we have a lot of patients at Children's, you can be admitted to our facility or treated at our facility up to age 21. So then there's that window that they're uninsurable. You know, there's really nothing for those children. And that's something that we've...
Well, Joe in the back here is going to be addressing some of this.
Oh, good. Okay, great.
And I think you want to add something, Joe?
Because I don't want you to fall into that black hole. But first, as soon as your child turns 18, the first thing that child needs to do is to go to SSI and apply for SSI, or go to DFACS and apply for Medicaid as their own individual. So you no longer claim them as a dependent on your taxes. That releases them from your household income, and then they apply as a person with a disability themselves for SSI and Medicaid through the Social Security Administration or DFACS.
Even though they'd still be living at home?
They can live at home, but you cannot be claiming them as a dependent. That is the key to it.
For the SSI. And what, sir, I'm sorry. He has a great point there. And what you're applying for is adult Medicaid. And we don't do adult Medicaid here. So that would be, you'd have to provide proof of income. Yeah, you have to go to the local DFACS office. And it's really, that's really a challenge, and he will be dealing with that more. But at that point, they're an adult. And you're applying for adult services.
And Estella, who will be here today, is the social worker from our adult clinic. And she'll be back during our adolescent transition conference, and she can help address that transition as well.
But that is something that we have brought that to the attention of the state. You know, what do you do, especially with children that there's that continuum of care. And that little window, how do you address that window when it's continuum of care?
Well, that affects your whole life as far as how long you can insure your children. And
Absolutely.
It gets to a point where I can't help anymore.
Right. Well, fortunately, you're up to 26 now. Yeah.
If it stays.
Thank God for that.
If it stays.
Yes. Any other questions? We have business cards, John. Those business cards they're random names. My name's on there, but call any one of those numbers. We're all available. We have the call center. Please feel free. Tell the community that Children's has a financial call center, and we're advocates for our families. It's our job to ensure that you know what your options are and you're getting to the right option for your clinical needs. Thank you.